Okay, so let's talk about trying to stay on top of health news. It feels like, I don't know, every single week there's a new headline, right? A new study, maybe a new variant.
Oh, absolutely. Keeping up can honestly feel, well, a bit overwhelming sometimes.
Totally. But that's exactly why we love it when you share sources with us.
Yeah.
It gives us something specific to focus on to try and cut through all that noise and figure out what the material you actually sent us says.
Exactly. And tracking something like, say, viral evolution in real time, it's incredibly complex. The data is always shifting. And what we see is really just a snapshot. So the sources you sent in, they give us a chance to really examine one of those snapshots, specifically about a new development.
And yeah, that new development is a COVID variant that you wanted to understand better. So for this deep dive, our mission really is to unpack the information in your sources, to get a clearer picture of, what is this variant? Where is it showing up? What does the material suggest about its potential impact? And maybe most importantly, what does the very latest data provided actually indicate? Ready to dive in?
Let's do it. Using the text you've shared lets us build a really specific picture of something that's, well, still evolving and being tracked by health bodies.
All right, let's start at the beginning then, according to your sources. They name this new variant NB.1.8.1.
Right. NB.1.8.1. And the material tells us it was first detected back in January.
In China, the sources specify. And then this is interesting. It's noted that it's been on the rise since about May 1st.
Yeah.
That seems like a bit of a gap, doesn't it? A few months between detection and really starting to trend upwards.
Well, that delay is something health officials are always watching, tracking those initial appearances, and maybe even more importantly, when they start showing up more often. That's absolutely key for understanding potential future spread.
And how quickly it might move. Makes sense. So, okay, from China in January, where have your sources said it's been popping up more recently? It mentions detection this week in California.
Correct. And that detection in California, according to the sources you shared, makes it the 6th U.S. state where NB.1.8.1 has actually been found.
The 6th. Okay, and the other states mentioned are Washington State, Virginia, Hawaii, Rhode Island, and New York City, detected there since March, apparently. Sounds like it's also being picked up in international travelers, which I guess isn't super surprising.
No, travel is always a major factor in viral spread, of course. What's maybe more notable are the numbers provided about its presence where it has been tracked more closely.
Like in California.
Yeah, in California, the sources state it increased from just like 2% of cases back in April to 19% this week.
Wow. Okay, 2 to 19%. That's a significant jump in just about a month there.
It is. And globally, the picture from the World Health Organization data cited in your sources is even more striking.
What does it say?
It suggests this variant makes up more than half of the variants currently circulating worldwide.
More than half. 50% plus.
That's what the source material indicates, yeah. That global number really stands out.
But then, okay, your sources also provide the context that it's not yet prevalent enough in the U.S. to be publicly tracked by the CDC.
Right.
See, that's the interesting contrast, isn't it? Just based only on the material you provided, over half the world's variants by one measure, but not even on the main U.S. tracking dashboard yet. The most dominant U.S. strain right now, according to the data you shared, is LP.8.1, making up, 73% of infections?
That's the figure given. And LP.8.1 actually descended from JN1, which, many people will remember as a major strain last year.
Right, JN.1.
So that difference between the global prevalence figure and the current U.S. situation, combined with the timing from initial detection to its rise, really highlights those regional variations and, importantly, the inherent lag in tracking something like this across different surveillance systems.
Yeah, that lag seems key.
What's dominating elsewhere might be on the way, but it's just not visible in real-time data here yet.
Okay, right. Let's dig into what your sources say this variant actually does. What are its characteristics based on the material you sent?
Well, lab tests mentioned in the sources suggest that NB.1.8.1 is more infectious than the strains currently circulating.
More infectious. Okay. And the potential consequence mentioned is that this increased infectiousness could lead to a spike in infections and hospital admissions.
That's the potential concern raised, yes. When a virus becomes more infectious, it simply means it can spread more easily from person to person.
Right.
And this could potentially lead to outbreaks growing larger or faster, even if the illness it causes in any one individual isn't necessarily at the speed it can move through a population.
Gotcha. What about symptoms? Do the sources say they're different this time?
According to the text you provided, the symptoms listed are actually pretty similar to those seen with other variants.
So the usual suspects.
Pretty much. We're talking about, fever, chills, cough, maybe shortness of breath, fatigue, muscle aches, headache, sometimes loss of taste or smell, sore throat, congestion. Even nausea, vomiting, or diarrhea are listed.
Okay, so a wide range, but nothing that immediately screams this specific variant just based on how you feel.
Exactly. Nothing mentioned that flags it as this variant based on symptoms alone.
And your sources include a really important point about testing. They note that a regular COVID swab, like the one you might take at home or at a clinic, it cannot detect which specific variant you have.
That's correct. Identifying the specific variant requires separate genomic surveillance testing.
Yeah.
It's usually done by public health labs on just a sample of positive cases, not every single test that's run.
Okay, good clarification. All right, so we know its name, NB.1.8.1, where it's been spotted, and what the material suggests about its infectiousness and symptoms. Now let's look at the actual data presented in your sources, because this is where the picture gets kind of interesting, especially with those tracking lags we mentioned.
Exactly. The data gives us specific numbers, but from different points in time and different locations. It's a bit of a patchwork quilt.
Okay, so in California, for instance, your sources provide data up to April 19th. What did it show then?
Back then, test positivity was 2.1%, described as holding steady. Hospitalizations for that same week were 1.3 per 100,000 people, which was actually a slight decrease from 1.6 the week before.
Okay, so steady positivity, slight decrease in hospitalizations in California as of mid-April. What about nationally in the U.S.?
Nationally, looking at data from May 17th to May 24th, so more recent, the sources show overall test positivity decreased slightly, from 2.9% down to 2.7%.
Okay.
And emergency departments ED visits for COVID also decreased by about 6.5% in that specific week.
But, and this sounds crucial, your sources add a caveat, right, about delays.
Yes, a big one. They mentioned there's usually a delay of several weeks for the most recent data to be fully reported. And on top of that, infections themselves can take weeks to actually result in someone needing hospitalization.
So the May 24th data might not reflect infections happening right now or even a couple weeks ago.
Precisely. And this is where looking at the international data your sources included provides, well, another perspective. Because while the latest available U.S. data snapshot shows some decreases or stability, the picture in some of the regions mentioned is quite different.
Like China. What do the sources say there?
Your sources report that in China, the proportion of severely ill respiratory patients with COVID jumped from 3.3% up to 6.3% over the last month.
Wow, nearly doubled.
And ER patients testing positive saw a really significant leap from 7.5% up to 16.2%.
Okay, that sounds different from the U.S. snapshot. What else?
And Taiwan reportedly saw a surge in COVID ER admissions rising 78% in just 1 week leading up to May 3rd.
78% in a week.
That's the figure cited. And Hong Kong hospitalizations also apparently hit a 12-month high, which the sources state is thought to be driven by this new variant, NB.1.8.1.
Okay, so you've got the U.S. data from late May showing things kind of stable or slightly down, but with that known delay. And then you have these international numbers from your sources, China, Taiwan, Hong Kong, showing significant recent increases in severe cases and hospital use potentially linked to this variant.
It really highlights that data lag and the regional differences, doesn't it?
Mm-hmm.
What we see depends so heavily on when and where the data was collected and reported.
Yeah.
The contrast in the reported trends is a key takeaway from the sources you shared, definitely. Reminds us the situation isn't uniform everywhere at the same time.
Right. Okay, moving on to vaccines and public health responses. What do your sources say about current protections? The current vaccines, they target JN.1, and as we mentioned, LP.8.1, the dominant U.S. strain, evolved from that.
Well, the California Department of Public Health, as quoted in the sources, states that, quote, currently available vaccines are expected to remain effective.
Okay, that's the official statement cited. Your sources also touch on the broader public health discussion, mentioning Robert F. Kennedy Jr.'s action related to vaccine access for healthy children and pregnant women.
Yes.
And the material just factually states that the vaccine is currently still on the CDC's children's vaccine schedule. That's just reporting what the source says about the current status, right?
Yeah.
No commentary added.
Exactly. The sources include that detail simply as part of the landscape of discussions and official policies surrounding the vaccine, stating its current CDC schedule status as of when the material was written. We're just conveying what's in the text.
Got it. In terms of public health warnings directly related to this variant, NB.1.8.1, your sources note that the California Department of Public Health has put out a warning about it.
They have.
And they also mention that some physicians in California have actually called for the return of mask mandates.
Yes, pointing to the situation in Hong Kong, where hospitalizations are high as part of their rationale, according to the sources.
So that shows different levels of response being discussed or implemented.
It does. These points from the sources illustrate different facets, official warnings, calls from some medical professionals for specific measures, often referencing international examples like Hong Kong, where the impact, based on the available data cited, appears more pronounced.
And there's one more quote here from the California Department of Public Health given to the Sacramento Bee, as cited in your sources. COVID-19 continues to circulate in California, and future seasonal increases in disease levels are likely.
Which serves as a reminder, really, that this is an ongoing situation. It provides context for the continuous monitoring and the potential for future waves, regardless of which specific variants are circulating at any given moment.
Okay, so let's try and bring this all back to you, the listener, who shared these specific sources with us. We've taken the information you provided and really tried to unpack what it says about this new variant, NB.1.8.1. We looked at its reported origin in China back in January, its detection and rise, particularly since May, where it's been found in the U.S., those 6 states, and how that compares, interestingly, to the global WHO data suggesting it's over half of variants worldwide. We covered what the material suggests about it potentially being more infectious, the list of symptoms, which seem pretty standard, and importantly, those specific data points you shared.
Right. The U.S. trends showing recent stability or slight decreases, but with that known reporting lag.
Alongside those international trends from China, Taiwan, Hong Kong, showing more concerning recent increases, potentially linked to this variant.
And we also touched on the official statements and related actions regarding vaccines and public health that were mentioned in your sources.
So understanding the information directly from the material you shared, that's really the core value here, isn't it?
Absolutely. It helps you look past just the general headlines to the specific data points and statements available in your sources. It lets you form your own understanding based only on that information.
While also being aware of the limitations.
Crucially, yes, being aware of limitations like those data reporting delays that the sources themselves highlight. That's key for interpretation.
Yeah. It's been, well, a fascinating look into the snapshot these specific sources give us about this new variant. From its initial appearance to these latest trends noted in different regions and the official responses captured.
And focusing purely on the source material, understanding its context, its limitations, like that noted reporting delay, it's truly essential for interpreting complex, evolving situations in health, wouldn't you say?
Absolutely. It's always great to help you dig into the material that's actually important to you.
Couldn't agree more. And maybe, as you consider everything we've discussed just now from these sources, the suggestion of higher infectiousness globally, that mixed picture of current data across different regions, and especially that mentioned delay in data reporting. Here's something to maybe mull over.
How does knowing about that data delay influence how you interpret the current situation as it continues to unfold? And what is that difference between the reported global prevalence and the U.S. tracking status? What does that suggest to you about the challenges of staying informed in a really fast-moving health environment?